Dr. Cottam, sir, the stage is all yours.
Okay. I guess we can move on to the next slide. So a little bit about me, a little bit about my background. I got my doctorate of pharmacy from Midwestern University in Glendale, Arizona. My undergrad was done at the University of Utah in Salt Lake City. And my career, worked primarily in acute care, worked for Vanguard Health Systems for 7 years, where I performed many duties from a clinical staff pharmacist to a clinical pharmacy specialist, eventually working at the corporate office, doing regional clinical work with the P&T, computerized provider order entry, and quality and safety initiatives, eventually culminating in becoming the director of operations for the 6 hospitals, and also managing a drug distribution warehouse where we did low unit of measure and repackaging and reprocessing of medications. And then after that, I got exposed to the industry, and probably learned more in a year and a half than I did in 7 years working in acute care. I worked for Premier Inc. As a senior region director that was dedicated to a couple members here in the Southwest, Honor Health and Banner Health Care Systems, also working with Presbyterian in New Mexico on pharmacy-driven initiatives and cost savings measures, as well as accountable care and population health initiatives. So, and currently, I am the Chief Clinical Officer for Compleremed Partners, which is a distributor focused completely on genetics. So what we do is pharmacogenetics and hereditary cancer risk screening, as well as inheritable disorders such as Fragile X, Mediterranean fever, and the list goes on, including autism spectrum disorder and pretty much anything else you can find in the 4,800 genes in the genome. So kind of a different realm, but very enjoyable, and learning a lot more than I thought I did about pharmacology and pharmacokinetics and the role that enzymes play in the metabolism of medication, even though that's one of the basic core competencies that we develop in pharmacy schools. All right, so next slide.
Excellent, thank you, Jordan. So we'll start with the first poll. So we know a little bit about you. Let's find out a little bit more about the people who are on the line. So attendees, if you would please answer the following 3 questions that we have. I will launch the first one now. So the question is, are you planning on completing postgraduate training? We've got about a 2/3 split for you there, Jordan. Are you able to see those results on your screen?
I'm actually not.
No? Okay, so you have 33% have said yes, they are planning on completing postgrad training, and then 2/3 have said undecided. You've got 0 no's. I'll close that poll. And we'll move on to the next one. So the next polling question is, what are your career expectations 7 years from now? And we'll open that poll. And the responses are working in a community pharmacy, working in a hospital pharmacy, working in a non-traditional role, or undecided. And we've got 100% of respondents in, and they all said working in a non-traditional pharmacy role.
Wow.
Undecided on whether or not to do postgraduate training, but 100% say they are looking for non-traditional. All right, and the last question at this outset, have you had non-traditional experience, pharmacy experiences? Yes, not yet, but have one scheduled, or no? And all are in. You've got 2/3 have said yes, they have had non-traditional experience, and 1/3 have said no. So hopefully, Jordan, that helps you out a little bit understanding who you've actually got here on the phone. Thank you, attendees, as well. And I will kick it back to you, Jordan, with this next slide.
Sure. So this slide is really related into why I chose the career path that I did. I can remember leaving pharmacy school and thinking to myself, all I wanted to be was a clinician on the floor. I now have my doctorate. I feel like I'm armed with an education that will, that I can make an impact in patients' lives. That's all I wanted to do. I wanted to be a decentralized clinical pharmacist. When I got to the hospital and I started working and I found all of the things that were deficient or broken, and we began to fix them and retool and develop protocols and deploy processes that inserted pharmacists in the daily operations in the clinical arena, whether that was daily rounding, antimicrobial stewardship, pharmacokinetics. What I started to realize was that it became repetitive. And for me, that repetitive nature of work is not what I enjoy. Right? Some people are very happy to go in and do the same thing they do every day. But I'm one of those people that if something isn't broke, I'll probably break it just to fix it. And so I put a quote on this slide and why I chose my path. And it's about being comfortable. And I had a very good mentor once tell me that I have to learn to live in an uncomfortable state. Because if you're comfortable, you're probably not growing, you're probably not changing, you're not evolving, you're not adapting. And so you have to continuously push yourself or challenge yourself to provide innovation, not only in your education, but provide innovation to your students, to your patients, to your peers. And you have to be seen as a leader. And you have to lead from the front and be innovative in how you message it and how you deploy it. So that quote was something that I read a while ago, and it has always resonated with me. But comfort was the key ingredient to making the prisoner crave the prison. And that's exactly what staying in a position long-term with no change and a repetitive nature to it was to me. It was a prison. And so every year and a half to 2 years, I've changed, I wouldn't say objectives, but I would change roles. I expanded into much broader or much more narrow operational experiences. So that's why I chose the career path that I did. I had to continuously change. It's a craving that I have. Next slide. So what makes my career fulfilling? I love the unknown, that anxious, that pit in the middle of your stomach, almost to the extent of GERD. You're uncomfortable. You don't know what's going to happen. Nobody's done it before. You've got to figure out what exactly it is that you're going to do, whether that's innovating a medication reconciliation process, innovating in a space where you're going to perform patient discharge counseling, but you have a limited number of FTEs and how you're going to deploy your non-clinical and clinical staff. And then there's the chase, right? There's the chase that's leading up to the result, right? And the chase is what drives me. It is undoubtedly the most exciting and gut-wrenching experience that you can have. But then there's the next step, right? Once you get there, once you've reached your accomplishment, once you have the result that you desired, or maybe it's a result that you didn't desire, maybe it completely failed, and that's okay. But there's always the next step. How am I going to pick myself and move myself forward in a different direction? Or, that's great, we've got this tackled, we've got to move on to a new project. We've got to find other ways to innovate to improve what we're doing. And then mentoring. I love to be a mentor. I've always been a professor or an adjunct faculty for Midwestern University since I graduated, also for Creighton. distance learning and for Nevada College of Pharmacy as well at Las Vegas. And so that always gave me a sense of satisfaction to impart some wisdom or some tools to the next generation of pharmacists coming up, because once you're 10 to 15 years out of school, these kids are coming out, they have all the information that's updated, they're 10 times smarter than you. They just don't have the experience. And you've got to help them and point them in the right direction. And there's nothing more satisfying than seeing one of your students or one of your mentees really driving success and driving change in the workplace or in the clinical care arena. Next slide. So, advice on pursuing a similar path. My recommendation to all students, all recent graduates, and really anyone, if you want to have a change of pace, if you want to get out of your comfort zone, you just have to raise your hand. So many times I see people sit back, because they're worried about failing or sounding stupid or not being, sure of themselves. Just raise your hand. Even if you fail, you're going to get that experience. You're also going to get that exposure to other people in the healthcare industry, whether that's big pharma, whether that's regulatory, whether that's the government, and even administrators in your own hospital or healthcare setting. You're getting exposure. You're getting an education. I learned far more from failing than I ever did at succeeding. And I know that's cliche, but I've probably failed at everything in my life at least 2 or 3 times. So don't be afraid to fail. Raise your hand and volunteer and get involved. Learn to live in that uncomfortable state. If you're not uncomfortable, you're not growing, you're not changing, you're going to become stagnant, you're going to wither, and you're going to be dissatisfied with what you're doing. And to me, that is far scarier than any death that can come my way. Find mentors. Mentors are so important. I have many: CMOs, CEOs, pharmacists, past students of mine. Everyone is a mentor to me because I can always learn something new from somebody else. Everyone has a different viewpoint and can provide different perspectives and ideas that you can build upon and take and mold in your own way to be successful. And finally, don't just think about things. Don't wish you would have done something. Go out and actually do it. So many times people come with great ideas, innovative ways on how to change healthcare, innovative ways on how to change business. They talk about it, but they're too afraid to do anything. They get too bogged down in the weeds. You just actually have to take the first step and do something. That's the most crucial aspect of success. Do something with the information that you're bringing to the table. Next slide.
Jordan, that's spectacular insight and excellent advice. For those of you here, the session is being recorded and will be available. I can assure you, I personally will be listening to this again. I think that was spectacular. For the last portion of the webinar, the attendees here, you get to select the path that we're going to take, where you would like Dr. Cottam to focus. So you have 3 options. Would you prefer that he focus more on what his current role entails, what space Compleremed operates in, or where Compleremed is looking to grow? So if you could respond now, Dr. Cottam will take the conversation in the path that you think is most interesting. It looks like we've got a blend here, a preference towards more on what your current role entails, and a little bit on where Compleremed is looking to grow. So more on your current role and then where Compleremed is going.
Sure, absolutely. So it's kind of interesting, right? Titles can be, are all about perspective and resume building. I never get, even though, Dr. Pope calls me Dr. Jordan, I think I've always just gone by Jordan, or hey dummy, or hey pharmacist guy, what's going on. But it being the chief clinical officer, it can lend some weight and credibility to to discussions you have with physicians and other healthcare administrators, and there's that aspect. But, keep in mind, I'm always going to stay grounded. You're not your title. You are who you are, and that's who, and people can see right through that. So as a chief clinical officer for a startup company, what does that really entail? Really, it entails developing strategy and giving guidance to my business partners who are more operational and contractual oriented into what we can actually do safely and really impact patient care, right? So in pharmacogenetics, there's a mixed bag of evidence, right? We know that with pharmacokinetic information, it's very predictable to manage what's going to happen with a medication. Pharmacodynamic, less so, right? As you start to look at transporters and different, receptors, and somebody might be more sensitive or less sensitive to a medication, it's less predictive, and it becomes more about a root cause analysis when you start to look at what patients are experiencing adversely. And so what we've really strived to do with our company is develop rational and evidence-based utilization of personalized medicine. And so my role was to create protocols, provide education, develop a strategy, and then deploy that strategy into the marketplace for utilizing pharmacogenetics and other personalized medicine tests to impact patient health and really population health as we partner with ACOs and large health systems. So that's what my role primarily entails, and really a lot of it is phone calls with doctors, answering questions and doing personal consults on patient profiles, but also doing ride-alongs and putting together entire population health studies with all of the data and looking at what their population looks like from a genetic mutation standpoint so that they can more predictively manage their formulary or the medications they prescribe. So you look at a population and 75% of the patients have a 2C19 defect, which means that they're going to have an issue with Plavix. That may not be a good population to stock up on Plavix patient assistance cards and prescribe that along. We might start looking at using Epi and Burlington more or less in our patient population to start out with before we actually have a genetic profile. So there's a lot of angles that we come at, and there's a lot of different things that are evolving in our company, and we're constantly growing and changing to meet the needs of the physicians and the population. But that being said, we also recognize the incredible importance that pharmacists make in management of patients and patient populations. And so as Compleremed grows, we are growing a medication management division along with a chronic care management division to assist physicians and ACOs in management and attainment of IHI and CMS's triple aim, improve the health of the population, improve the patient experience, and decrease overall healthcare costs. So lots of large aspirations, but almost there, almost to fruition on the medication management and putting pharmacists at the forefront and on the front line to manage those high-touch patients with the chronic long-term disease states, diabetes, hypertension, hyperlipidemia, et cetera.
Excellent. So the direction that Compleremed is going to go next, I mean, it sounds like you're kind of in a leading edge portion of therapeutics here. What's kind of on the next horizon for where you guys are going? Is it more focused on working with providers? Is it more working with payers? Is it more getting into the validation of the research and the methodology? Where are you guys going?
Well, we're actually looking more into the provider side. We're going to be working very closely with physician offices, large physician practices, and then also ACOs. Currently, we are the contracted vendor for pharmacogenetics, toxicology, and inheritable risk disorders for a large ACO in the Southwest. but we are also in the process of finalizing a contract to manage their patient population from a medication management standpoint. Not MTM. Don't get this confused with MTM. This is more chronic disease state management, where we work as a physician extender in physician offices, providing that expertise that only pharmacists can provide. So really what we're looking at is, we'll manage measurable metrics, from FEV to A1C and hypertension, and blood pressure and all those fun, measurable outcomes that we have to show to show value. But it's very promising, and the ACO is extremely excited about it, especially as they're entering their second and third year of measurement for their MSSP program, this Medicare Shared Savings programs. And it's pretty innovative. Not saying that other people haven't done it, but actually deployed it on a large scale has yet to really be accomplished. So.
Excellent. Well, thank you for that. We'll turn it over to the folks here on the line, and please feel free to pose questions to Dr. Cottam in the question bar there within the webinar. And while we're waiting for the first question to come in, I noticed during the initial polling we did, it looked like there were a handful of folks who probably wanted some non-traditional pharmacy experience and training, but didn't necessarily have it nor have it scheduled. Jordan, do you have any recommendations for where students might go to get exposure, whether it's internships or shadowing experiences in the realm that you get to operate in? That, by the way, sounds exceedingly fascinating.
Well, I think that probably one of the best places to start, and not to sound too pandering, but Premier has a really good opportunity for pharmacists and pharmacy interns to experience something that probably greater than 90% of pharmacists never experience. It provides insight into contracting, population health, big data, healthcare evolution, and really can really expose them to very innovative ways to look at how we're managing the changing healthcare landscape. So I would look at Premier Inc., like the GPOs, group purchasing organizations, is a fantastic place to start because they have access to everything. If you're interested in a specific niche market, like distributors, right? McKesson, Cardinal, Amerisource, Bergen, that's also another place that you can inquire to. They offer an insight into contracting and distribution and supply chain that is pretty fascinating. And then as well as big pharma. Big pharma, I use the term loosely. I used to work part-time for Janssen as a speaker, and then I currently work part-time for AbbVie as a speaker in their non-branded section. But the money that they have to throw at innovation in a way that they can, obviously everything is tainted a little bit with, generating a profit on the back end, but they have some pretty innovative tools that they develop in the IT space, which can kind of drive things towards their product, but also are usually free to healthcare providers and helping them manage their patients. So, when we look at non-traditional, there's contracting segments and there's expanding segments. Specialty pharmacy, definitely expanding, right? And that's something that you really don't get a lot of in pharmacy school. It's out there. You don't really know what it entails. Specialty pharmacy is incredibly fascinating. And it's a big growth business, and it's going to continue to grow and this is all really focused on the evolution of genetics and how we manage patients more predictively than reactively, right? Genetics has really opened up a whole new realm of treatment modalities, not just with pharmacogenetics, but also tumor typing, right? Like we can type certain tumors to tell you which therapy is going to be most effective, which to me is fascinating. We can also tell you that if you have certain mutations or certain genes, certain genetic mutations, that you have a 90% chance of developing colon cancer or breast cancer. And we're going to establish a care pathway that will help you minimize the risk of developing that, but it also means that we're going to screen you more rigorously earlier to make sure that we catch something sooner, so that when we have to treat you, it's much less invasive and it contains the cost, or the impact of cost to the overall healthcare system, right? Treating somebody with stage 1 colon cancer is a lot different than treating somebody with stage 4 colon cancer. So, that's really where medicine is starting to go, is the ability to predictably manage patients. And so if you're looking for a non-traditional path that's innovative and on the quote-unquote bleeding edge, getting into genetics is probably one of the most fortuitous things you can do.
So along those lines, actually, it's a kind of a great segue here into the next question that we have from the audience. How did you know about the position, your position being open at Compleremed Partners?
So, I wish I had a really fancy story to tell everyone, but it really occurred over a beer at a local bar in Phoenix, Arizona. And that's it. There was sitting there having dinner and got to talking with somebody who was looking for a clinical partner to help round out their administrative team, and in pharmacogenetics, and the rest is history.
So let's expand that one layer further then. How did you find out about the opportunity that you had at Premier?
So the opportunity at Premier came about as I hit my 7-year mark. I got the 7-year itch with Vanguard and was looking for an opportunity to expand my skill set outside of just acute care operations. And there was a posting online, but I actually had an acquaintance that worked at Banner, and they said, hey, we're looking for a pharmacist to actually fill this position to help us with cost containment in pharmacy with somebody that has a similar skill set to what you have. And I said, wow, that'd be great. So I met with the VP of Supply Chain and their pharmacy director of pharmacy contracting, hit it off, and joined Premier. And I guess the bottom line for that, the all-encompassing message here is networking. If there's anything that you can do to help your career, it's all about networking. And it really is true. It's not what you know, it's who you know. And so being able to develop relationships and relate to people is far more important than being the smartest person in the room. Given pharmacists are usually the smartest people in the room, but it's very important to be able to foster that and be able to network as efficiently as possible. It's a really big deal. I can't stress it enough.
Excellent. Well,
do they offer networking courses?
Do they offer networking courses in school?
Yeah, they should.
They should, right? They absolutely should. In the experience I have working with a handful of pharmacy schools around the country, that is not something that's offered that I've been involved in. And I got a minor from my alma mater, Ohio Northern, and there was nothing available in the networking space at the time. And you would think if there was a time when networking classes would have been more needed, it was certainly when the likes of LinkedIn did not exist to give you the capacity to do that networking. Yeah. Well, Jordan, thank you very much. And we're getting thank yous here on the line here as well for answering the questions and for your time. You and I have spoken about this already, and we're going to make a donation to the charity of your choosing, the Ronald McDonald House Charities, as a thank you for your experience, sharing that experience with us and for sharing your time. Very valuable, priceless information for us, and thank you so much. For those of you on the phone, there is a handout available for download right now. It is the breadth of the entire series. It will be available on the first and third Wednesday of each month this summer. And you can get all the information on the upcoming series through that handout. We'll also make the recording and the slides available for download through CareerScript in the forum section. On the conclusion here, give us a couple days to get that turned around. Dr. Cottam, from the bottom of my heart, and thank you from everyone here on the phone. We greatly appreciate your time. For those of you attendees on the line, we hope you enjoyed the session and hope you're able to join us next time. Have a good evening.
Thanks.